Well, July 9th in the morning, we went to Cedar Rapids to see his cardiologist, and he said it was not his heart, but he had infection somewhere. And then at 12:30, he had a scheduled appointment because he had been in the hospital, so he needed to see Allison. So we got up there and we went back, and Leah, she knew something wasn't right. So she took his temperature and his pulse, and then she said, I need to get Allison, so I'll be right back. And Allison came in and she took one look at him and she said, we need to go to ER now.
Being Paul's primary care provider, I knew immediately upon entering the room that day that he was in a dire condition. At that time, you need to assess and prioritize their medical needs and interventions, which for Paul meant immediately getting him to the emergency room.
He was already in the wheelchair. Leah came and got him. I could hardly keep up with her. We were moving so fast.
Yeah,
So
she came in and we were on our way.
I think understanding how to treat a patient is really through experience. And I have been through many experiences where I now know if somebody is extremely ill or just mildly ill. And looking at Paul that day, I just knew that something was not right. And even seeing Allison come out of the room after seeing the patient, I knew that at that moment that something was wrong. So I made it my priority to get him down to the ER as soon as possible so that he could get the proper care that he needed.
we got down to ER, they were waiting, and they got him on the table, got his shirt off, got everything hooked up like you normally do to check his heart and everything. And Tanya came in and she said, well, hello, you two. She took one look at him. I never saw a person move so fast in my life and show up with 8 other people.
Well, I do know Paul. I know Paul from just seeing him in the hospital in other areas, but I also know him as a patient. And I also know him to be very friendly and upbeat. And when I walked into the room that day, I knew that he was sick and he was definitely not acting like himself. And we needed to treat him very quickly. You know, obviously, Paul needed a tertiary care facility, a higher level of care, and you know, we did our job that day. We stabilized him. We treated him as much as we could here, and we also were able to facilitate the transfer by communicating with the receiving facility.
And if it hadn't been for Allison and Tanya and that whole group, he would have died.
Hearing that from Sandi is, of course, deeply humbling. Knowing that I had a positive impact on Paul's life that day is rewarding and reinforces why I went into the career of healthcare.
I think one of the biggest challenges of being a nurse is sometimes you are underappreciated. You're not always given a thank you for something that you've done. I think that even Sandi and Paul mentioning that they were thankful that I took a small part in just getting him to the ER quickly that day just reminds me of the impact that I can make in a patient's life.
I mean, of course, it makes you feel good that he feels that I helped facilitate what he needed that day. It takes an entire team that's on the same page. They know their role. They know what needs to be done. They know that in those situations we need to move very quickly. We need to be very decisive. And I am very proud of the team that we have here in the ED at Regional Medical Center.
I mean, it was an experience that I hope I never have to go through again.
We're very lucky.
Yeah, we are so lucky to have a hospital we do.
I've always had the passion for caring for others and putting others even before myself. And I think being back in this community has really given me the opportunity to give back to the community that has given me so much. And I think that is just extremely fulfilling.
I chose a career in healthcare because I've always been driven by a desire to help others. The opportunity to make a difference in people's lives during their most vulnerable moments is incredibly rewarding.
One day it just dawned on me that I wanted to do something that helps people. I didn't know what that was for me at that point in time. I've worked in the ICU, I've worked in other settings in healthcare, and the emergency department just fits my personality. I take a lot of pride in what I do here, not just in those scenarios, but like just everyday routine patient care.
RMC is a good place.